Hi, I'm Dr. Megan Williams with the Oklahoma State College of Veterinary Medicine, and I'm going to show you how to bandage the knee of a horse. So first we're going to go over a little bit heavier knee bandage. This would be indicated if you had a bad wound over the front of a knee to where you didn't want them to be bending and straightening their knee quite as much, and or if you were wanting to squeeze a lot of swelling out of the carpus or knee, this would be a good type of bandage for that. And then I'll also show a lighter, less intense type of knee bandage as well. So first we'll go over the materials for the heavy knee bandage. So first and foremost, you're going to need a combine roll of some kind. So at some of the feed stores, they sell Gamgee rolls. That would be a similar product that would be okay. I like the Combi roll, which you can purchase as a whole roll from the Frank & Williams company. That's one good example that we like to use, but a Gamgee roll would work for that as well. Then you're going to use the Jorgensen brown gauze rolls or some kind of rolled gauze. I usually use 2 rolls for this type of bandage because it's cheap stuff and it makes the bandage hold up a little better if you use a little bit extra of that gauze. Then some kind of vet wrap, and then elasticon. So before we apply the bandage, I just want to show a good example of what can happen when somebody applies a bandage that doesn't necessarily know what they're doing. So that's what happened in this particular instance. This horse had a wound. It's actually still healing above the knee here, and we were having them bandage the knee to protect this wound while it healed. So in the meantime, if you come around, the bandage got a bit too tight on the horse and there wasn't enough padding or protection on a prominence that horses have on the back side of their knee called the accessory carpal bone. It kind of sticks out the back side of the knee of the horse, and there's not a lot of soft tissue protective covering over it besides just skin. This also happens in the back leg on and just above the point of the hock if you're bandaging a hock, just for reference as well. So we usually try to create some kind of extra padding and or soft or pressure relief area when we're bandaging a knee or a hock in a horse so that this doesn't happen. But what happened to this horse is he didn't have enough padding here and probably too much pressure and maybe not applied in an even fashion. And as a result, if you come around the back side of the knee, you can see that this horse wound up with, it's healing now so it's improved, but this horse wound up with a pretty severe pressure sore on the back side of the accessory carpal bone there, which has taken, this is actually a couple weeks out, so it's got some substantial healing from when that first happened. So sometimes you can actually do more harm than good bandaging a leg. This horse probably would have been better off if we had just stopped bandaging the leg before this happened. So make sure that you pay attention to those bony prominences and plan accordingly when it comes time to do your bandage. So now I'm going to show you how to apply the heavy bandage. Okay, so we want to position the horse so that he's standing somewhat squarely and weight bearing on that leg. Then I'm going to take my combi roll, and I like to position the combi roll for a heavy carpal bandage so that the bottom of the bandage is roughly at the bottom of the knee, as long as that covers the subject I'm after, because it has a tendency to keep the bandage from sliding down the leg as quickly. The other thing you may have to do with this bandage is apply just a standing wrap with reusable, like a quilt and polo, underneath at the end just to help kind of support that bandage. So I'm going to start on my knee and I'm going to roll my combi roll on to the horse with as few wrinkles as possible, which is sometimes challenging. But we want it to be relatively smooth. Then I'm going to take a roll of my brown gauze, and I typically start in the middle because it helps hold the bandage in place while I get going. And you can go fairly snug as long as you have adequate padding underneath it, but you want to use even pressure and you want to overlap this brown gauze roll by about 50% every time that you come around the leg of the horse. Now when I get down to the bottom, I want to leave a little bit of white of combi roll sticking out at the bottom and then again at the top of the bandage. And the reason for that is if you go past that with your brown gauze or in the next step with your vet wrap, you can kind of have a tourniquet-like effect on the leg, and we don't want to do that. So we want to make sure that we're not going past our padding. So again, overlap by 50% every time you go around. You do have to go fairly snug or it's just going to slide right off of the horse. But again, as long as you have adequate padding underneath, that should not be an issue. And again, don't go past your white at the top. So you want to leave some at the top, some at the bottom. And I just keep going till I run out. Again, I like to have 2 of these rolls just because this stuff is really cheap and it makes the bandage stay on a lot better, helps it stay secure. So overlap by 50% of this width every time you come down, nice and snug, all the way down but not past the white. Work your way back up to the top and just go up and down like so until you run out. Try to use even pressure, so don't pull tight one time around and loose the next time around. Try to keep your pressure pretty even the whole way down. You can see that looks nice and smooth. Next, I'm going to take my vet wrap. And I just start right at the top, and I'm not going to go past where the brown gauze is at any level. This is just another protective layer. Vet wrap, as long as you have good padding underneath, can again be pulled pretty snug. So it's got kind of that wrinkly texture to it. I basically pull tight enough that the wrinkles come out, and that's how you can gauge whether or not you're putting your vet wrap tight enough. If you pull much tighter than that, it's going to rip. So good rule of thumb. Again, never ever ever go this tight with vet wrap unless you've got a good thick layer of padding underneath. And just like with the brown gauze, we're going to overlap by about 50% of its width every time we come around the leg. And I use a full roll, so just keep going until you run out. Okay, like so. Now I have one more step, and that is some elastic-on tape. So this is like a sticky medical tape. That's to kind of hold the bandage in place. Again, helps keep it from sliding and also keeps like dirt and shavings from getting in to your bandage from either end. So I'm going to go around the top so it's halfway to bandage, halfway to skin. And then I just go a couple of times around the leg. On the elastic-on, you don't want to pull it too tight, again, because you don't have padding under that layer, and you don't want to tourniquet the horse's leg. So a couple times around, take my scissors and just cut, and then do the same thing down below. So halfway to the skin, halfway to the horse, around the leg, like so. Probably the most expensive part of the whole bandage is this tape right here. So you don't need a ton of it for this particular indication. And then if you recall at the beginning, we talked about protecting that accessory carpal bone, and you'll notice for this heavy carpal bandage, I have covered the entire thing with my bandage. But a couple of things to note about that. First thing is that I've got quite a bit of that combi roll padding underneath. Second thing is I'm going to cut a little relief incision for the horse on the back side of this. So I come right where that bone is, and I take like a little pair of scissors or a blade, and